Here is a picture that tells the princess is sleeping and the prince is just approaching her, and it is thought that if he truly loves her, he will not allow, it will not make her wake up, and it will just let her sleep. So that is the approach one should have. Now, coming to the warts, the diagnosis of the wart, history and the visual examination will help scrape off the top layer of the wart to check for the signs of anything else. Dark pinpoint dots, clotted blood vessels will be seen, and rarely the skin biopsy or the shape biopsy, which is a definite diagnosis, will tell the diagnosis. Here one can see the HPV infected cells and the blood vessels and lot of the viruses which are there, and that is just making the form of the wart, that is the cut section of the skin through the wart to tell that what it is made up of, and visual examination, and that is having the specific peculiar shape that can also help in diagnosis. The micrograph of a common wart vulgaris showing the hyperkeratosis, acanthosis, hypergranulosis, GT-rich elongation, and large blood vessels at dermoepidermal junction on H and E stain. One can appreciate all these features here in this diagram, which is showing all this hyperkeratosis, acanthosis, and hypergranulosis, and the elongation of the blood vessel. Now, what are the differential diagnoses of the wart? Callus, direct pressure hurts, the wart hurt with side pressure. So this is how one can differentiate. Core is central hyperkeratotic core, pitted keratolysis, seborrheic keratosis, flatter, darker, velvety in appearance. Pigmented Vercus nevi projections are not dry and rough. Then lichen planus, molluscum contagiosum, and squamous cell carcinoma, these all have the specific shape, and they are just going to give you the wrong appearance of the wart. So here one can see the callus, which is the hair on foot on the plantar surface, core hair on that, then pigmented varicose nevi, as the shape can be appreciated and can be differentiated from the warts. Then molluscum contagiosum, that also have a typical appearance, and that is different from the warts. Then lichen planus, as one can see, the spot-like lesions, these are also different from the warts. And then pitted keratolysis, as one can also appreciate that, and seborrheic keratosis with irregular margin, that is also giving the shape of the wart, but actually these are not wart. So these are all the differential diagnoses. Now, coming to the treatment of the wart, there is no treatment, especially in the children, as most warts are harmless and resolve automatically after some time, months or years. Treatment speed the resolution and depends upon the patient age and health, and also the type of wart with which the person is suffering. There are many treatments for that, and these treatment, number one, topical salicylic acid treatment, or called chemical peels, silver nitrate treatment, cryosurgery or cryotherapy, laser treatment, infrared coagulator, blistering agent, intralesional immunotherapy, immune system modifiers or immunomodulators, that dinitrochlorobenzene, DNCB application, and bleomycin or fluorouracil cream, topically benzyl peroxide application, zinc sulfate treatment, antiviral intralesionally, then antiviral topically, fat-soluble garlic extracts, duct tape occlusion therapy, formaldehyde application, electrodesiccation, surgical curettage of the wart, and mechanical removing of the wart and varotop. These are 21 treatment options for the wart, and I am going to just discuss one by one. Now, the first is topical salicylic acid or the chemical peel that is very effective in a higher concentration, which is about 20 to 60% in soft paraffin liquid. It causes keratolysis of the dead surface with the cells. Keratolysis means the keratin layer of the skin is going to be lysis. So keratolysis. Other peeling medicines are tretinoin and glycolic acid, available as liquid, gel and patch form. And be sure to soak wart in the warm water first. Then over-the-counter products are of two types: adhesive pad treated with salicylic acid and bottled concentrated salicylic acid solution available in the bottle that can be applied on the wart. Here one can see the topical salicylic acid treatment. Salicylic acid in the liquid form can be applied on the wart. Similarly, that is also the application of the wart by this salicylic acid, and it is also available as the plaster, which contains the patch of the salicylic acid in the center, and here one can apply this patch on the part which is affected, that is on the wart. So that is corn and wart plaster also said to be sometime, and that is applied on the part, and that is applied at night and removed in the morning, so that it is going to have the keratolysis effect and just make the superficial layer of the wart. The second treatment is silver nitrate treatment. Given for the 9 days, it cleans all the warts, but it causes staining of the skin and the clothing. Pigmented scars may develop. Third is the cryosurgery or the cryotherapy. It is as effective as salicylic acid. It involves freezing the wart with liquid nitrogen, creating a blister between wart and the epidermal layer, so the wart and the surrounding dead skin falls off. Not painful. 3 to 4 treatments are required for the full effect. And warts on the closed skin like plantar warts need more treatment because they are more thicker and need more application. It causes dark spots in the people who have dark skin. So that is one of the problem with the cryosurgery. Here one can see the silver nitrate that can be used. That is caustic pencil. It contains silver nitrate. Then one can have this cryo. It freeze spray, which is just being applied on the wart. And here also the liquid nitrogen that is being applied on the wart. And here also the liquid nitrogen in a container that is being sprayed on the wart. This just freeze the wart and just peel it off after some time. Number 4 is the laser treatment. It kills the tiny blood vessel within the wart. It is of two types: pulse dye laser or the carbon dioxide laser. The pulse dye laser, wavelength 582 nanometer, work by the selective absorption by the blood vessel, especially the hemoglobin, and these are less destructive and heal without scarring, does not need sedation or the local anesthetic, as it is not painful. The carbon dioxide, the other type of the laser, carbon dioxide laser, work by selective absorption by the water molecule by vaporizing and destroying the tissue and the skin. It's painful, so require the local anesthetic and does not cause the scarring. Number fifth is infrared coagulator, an intense source of the infrared light in a small beam like a laser. It works as a laser treatment, but it is less expensive but causes blistering, pain, and scarring afterward. Here one can see the laser treatment. The laser beam is applied here on the wart. Here again the laser beam is just put on the wart. And this is infrared coagulator, and it is just having many applicator with which one can just use according to the size and the type of the wart. So that is infrared coagulator with multiple these applications used for the different kind of the warts. Number 6 is the blistering agent. Cantharidin, found naturally in the bodies of the beetle family Meloidae, causes the dermal blistering. Painting it so a blister form under the wart. Now clip away the dead wart, which is dead now, used alone or compounded with the podophyllin sometime. Number 7 is intralesional immunotherapy with purified candida, MMR, and tuberculin protein, PPD protein. It appears safe and effective. That can be given into the lesion, so that is called intralesional immunotherapy. And here is the blistering agent, cantharidin, that is being applied on the wart, and here is the result, that it is just going to cause the blister, and that is peeled off the skin, and the remaining skin is okay. Here is intrarenal immunotherapy. BCG can be given or MMR can be given into the wart, that is going to just destroy the wart. So that is called intrarenal immunotherapy. Number 8 is immune system modifiers, or these are called immunomodulator for stubborn warts that do not respond to the traditional treatment, as we have discussed previously. So imiquimod, a topical cream, helps body's immune system to fight HPV via interferon production. It is approved by FDA for genital warts. Apply a chemical DCP, diphencyprone, to the warts. Mild allergic reaction occurs. Another type is getting injection of the interferon, and this is called immunotherapy. Eldera 5% cream, which contain imiquimod, and here the imiquimod dermo, that is being used as immunomodulator. Number 9 is dinitrochlorobenzene, DNCB application, like salicylic acid applied directly to the wart. It is effective very much. Cure rate is about 80%. Use more cautiously than salicylic acid, as chemical cause genetic mutations in the body. It induces an allergic immune response, causing inflammation that kills the virus causing the wart. And here is that DNCB powder, which can be applied on the wart. Now, number 10 is bleomycin or fluorouracil. Bleomycin is a cytotoxic drug used for the cancer. 1 to 2 injections into the wart, as one can see, the bleomycin injection is given into the wart. It destroys the viral DNA or the RNA. Side effects are the nail loss, necrosis of the digits, and the Raynaud syndrome seen with this injection. Fluorouracil cream, a chemotherapy agent for the resistant warts. It blocks the viral DNA and RNA production and repair. So here is the fluorouracil topical cream as 5%, which can be applied on the wart, or the bleomycin injection that can be given into the wart and causing the. Here is a beautiful imagination of a person or a painter who have made this. Just the birds which are found in the sea, these are just going together on the hand of a beautiful lady, and this is just giving the impression of a painter. That the birds can be attracted by the very beautiful hand of a person if that is available there. Now, coming to the treatment of the wart, 11th is the benzyl peroxide application. It is effective in treatment of the flat warts only, available in the form of a caustic pencil. So, the caustic pencil which contains benzyl peroxide that is used to remove the common warts, so that is the benzyl peroxide application. The 12th is zinc sulfate treatment. Consumed orally, it reduces or eliminates wart. Dose is between 5 to 10 milligram per kg body weight per day. A low dose of 2.5 milligram per kg per day is sufficient. Excess cause copper deficiency. Topical zinc sulfate solution or zinc oxide are also effective. As one can see, the zinc sulfate topical cream can be applied on the warts on the face to get rid of these warts. The 13th modality is antiviral intralesionally. Cidofovir, an antiviral drug, is injected into HPV lesion, as one can see, within laryngeal papillomatosis. So the laryngeal warts, as one can see in the larynx, that is being injected by the cidofovir, and that is the treatment of choice for laryngeal larynx wart or the laryngeal papillomatosis. Number 14 is antiviral topically. Lopinavir is effective against HPV. One tablet BID applied topically to cervixes of the woman with high grade and low grade precancerous conditions. After 3 months treatment, 82.6% of the women with high grade disease had normal cervical conditions. It is confirmed by the smears and the biopsy. So this tablet, which is lopinavir, is applied topically in the warts which are in the cervix, and it is being applied for 3 months, and that is just able to get rid of the cervical warts, and these are very effective because these cervical warts are the precancerous, and one can get rid of this by applying this. 15th modality is fat soluble garlic extract. Shown result in 90% of cases. Applied twice daily and covered with an adhesive bandage. Improvements within 2 to 4 weeks, and total clearing area is 6 to 9 weeks. As one can see how to remove the flat warts by applying the garlic extract and or spraying the garlic extract on the wart, and that is just going to have improvement in 2 to 4 weeks. Number 16 modality is duct tape occlusion therapy. It involves placing a piece of duct tape over the wart. Mechanism of action is unknown, but it has been used and in the past that the duct tape applied on the wart can also make the wart to disappear. Now the 17th treatment is formaldehyde application, and 18th treatment is electrodesiccation or electrosurgery. It is the burning, good for the common warts, filiform warts, and the foot warts, as one can see, that is by the cautery or by the heat or by the electrodesiccation or by the electrosurgery, the warts are being removed and being treated by this electrodesiccation. Now the number 19 is surgical curettage of the wart. This is very common and being used very commonly. Scraping off or the curating wart with a sharp knife or other tool. These two procedures often are used together. Excision, cut out wart, excision as one can see with the knife or with any sharp thing, one can just remove the wart and from the root it can be removed. Then number 20 is the mechanical removing. Erosion of the wart with a pumice stone, blade, etc. that one can see. This rough pumice stone is able to just make slough of the wart and just to get rid of that. Now, number 11th and the last treatment modality is Verutop. Verutop Verruca treatment is a topical solution made from the combination of the organic acids, inorganic acids, and the metal ions. This produces nitrates which denature the viral protein and mummify the wart tissue. Good point is Verutop does not damage the surrounding skin. So, one of the very best description of the parenting is that the father is having lot of holes and the child was also having the lot of holes, but father have given his body parts to fill the gap of the kid, and now the kid is without any gap and the father have the multiple holes. This is how the father do give everything they do have with them to the children, but the children cannot pay back what the fathers have done for them. So keep the sacrifice of your father in mind. You can't pay back. Now, the prevention of the wart, avoid shaving over a wart. Do not bite nails or the picking at the cuticles like this. Do not share towels, wash clothes, clothing, nail clippers, razors, or the other person's item. Do not touch another person's wart. Get HPV vaccine and use condom to prevent the genital warts and keep dry to prevent spread of the plantar warts. That is, if you will keep the feet dry, it will just prevent the spread of the plantar warts, because the wet feet are responsible for spreading the plantar warts. Now, wear shoes when using a public locker room, pool area or the showers. Gardasil 6 is an HPV vaccine to prevent cervical cancer and the genital warts. It prevents infection with the HPV type 16, 18, 6 and 11, not against the plantar warts, verrucas, but it prevents only against type 16, 18, 6 and 11. And these are responsible for 70% of the cervical cancer cases, vulvar, vaginal, penile and the anal cancer. So one can prevent up to 70% from these cancer. Now, the vaccination by the Gardasil, as one can see, it is the quadrivalent human papilloma virus against type 6, 11, 16 recombinant vaccine. Now, some very interesting facts about the warts are that English folk believe touching the toads causes the warts, and the German believe touching a toad under a full moon cures the warts. Remedy, throwing a dead cat into a graveyard, and the other remedy is splitting a bean, drawing the blood from the wart and putting it on one of the halves and burying that half at a crossroad at the midnight. And the other remedy is rubbing wart with the potato, then buried. When buried potato dries up and wart will be also cured. So here are, despite their appearance, toads do not cause wart. Here is the throwing the cat, and here is splitting the bean and putting the blood of the wart in that, and here is the potato which is being buried and allow it to dry to have the remedy. So that was the end of the what I have given the every possible aspect of the wart and every possible modality to treat it. I hope you may have liked this lecture. If you have liked this lecture, please subscribe it and just share with others. If you don't like, now do not hesitate to call me or to tell me, and in my comments I will not hesitate to act upon. Thank you very much.